For our Strike a Spark presentation, we called it Collaboration in Royal Communities, a reverse case study by myself, Ashley, Emily, and Sarah. To start out, Ashley, myself, I work in Presley Ridge in Washington County. Presley Ridge, we receive referrals from Washington County Juvenile Probation and Washington County CYS. For this case study, we received a referral from Washington County Juvenile Probation for a client named Josh. Josh is a 16-year-old male who is biracial. In the referral, Josh was coming home from placement in a week, and the probation wanted services in place before he arrived home. Ashley will go to the home and open up the case with Linda, who is Josh's grandmother, where Josh will be residing when he gets home from placement. Ashley will complete the intake to go over the goals listed to be completed by the family in order to be discharged from services. While Ashley was in the home working with Josh and Linda, Ashley noticed that Josh had some mental health concerns, and Linda had some concerns with getting around the house, some grocery shopping, her mental health, and also her physical health. As Ashley was working with the family, Ashley took it upon herself to have conversations about referring Josh to mental health services and also Linda to the aging services. Ashley referred Linda to Emily, who works at the local agency on aging. Ashley gathered releases from Emily and Linda so that she was able to communicate the progress or concerns with Linda and Emily. Ashley then referred Josh to Sarah, who works at SPHS for mental health services. Ashley gathered releases from Sarah and Josh to also communicate about his progress and or concerns.
Emily receives a referral from Ashley. Emily works at the local area agency on aging. The area agency on aging provides services to older adults who are over the age of 60 that reside in the community. There can be assessments for in-home services, guardianship services, protective services, referrals for information, other services. It was reported to Emily that Linda needed some help in her home as things are starting to get a little bit more difficult for her now that she is getting older. Linda is 60 years old, so she does qualify for services. The goal for the area agency on aging is to allow older adults to remain in their homes as long as possible and to remain as independent as possible. Emily would gather information from Ashley and Linda to make appropriate referrals within the agency. Ashley shares that Linda is overwhelmed with caring for her grandson, Josh, who has unwanted behaviors and a history of mental illness. Josh has lived with Linda since he was 8 years old. He is recently involved with probation and is being discharged from placement. Linda has her own untreated mental health issues that are not helping the situation. Linda has a diagnosis of schizophrenia. She also has physical limitations and breathing problems. Linda feels she would benefit from assistance with grocery shopping, light housekeeping, laundry, and some personal care in the home. Emily discusses different in-home service options with Linda. Linda agrees for Emily to make a referral for her to receive option services in her home. In order for Linda to receive services, she must be agreeable. Different service options include option services, which are help in the home a few times a week, or CHC waiver services, which is someone that requires a higher level of care but wishes to remain in their home. To make a referral, the client's information is sent to the assessment unit at the aging office, and then the assessment unit gathers the information and completes what's called a functional eligibility form. Right now, that is being completed via phone, but prior to COVID-19 times, that would be done in the home. This assessment will determine Linda's functional eligibility, determine if she needs minimal help or a higher level of care. So Linda was determined to be NFI, which is nursing facility ineligible, so she will receive option services. Based off Linda's low income, she will not have a cost share. Linda will receive a care manager assigned to her that will oversee her case. As Linda's care manager, blanket referral would be sent out to a number of home health agencies in Linda's area. Once a provider is found, they will be able to implement appropriate caregivers to help with Linda's needs. Staffing may be difficult to find due to Linda living in a rural area, especially with COVID-19. Home health agencies have had great difficulty staffing home health aides.
Like Linda, Josh would also be referred for services. Again, Josh is a 16-year-old biracial male in the Washington County area who has been recently released from placement. Ashley referred Josh to Sarah for mental health services at the SPHS location in Washington. Ashley and Sarah would work together to gather a release from Josh in order to contact one another regarding Josh's case. Ashley would provide Sarah with information that is relevant to the case, such as any previous diagnoses, prior treatment and services, and/or medical history. Next, Ashley and Sarah would collaborate in order to perform an initial screening on behalf of Josh. This would gather basic demographic information, which would assess his needs for services. Sarah would provide Ashley with information regarding the next available intake, such as the date and time, which she could then provide to Josh specifically. During intake, Josh and Sarah would work together to complete his initial intake, which would include a psychosocial evaluation. Throughout this assessment, they would work together to complete identifying information, family history, any prior employment, education, abuse, physical, emotional, or sexual, substance use, legal situations, and also suicidality. Based off the intake session, Josh admitted to having some trouble controlling his emotions, experiencing behavioral issues, and also a previous childhood trauma. He had a prior diagnosis of bipolar disorder, and based off of this information, a modality of outpatient level treatment, 1 time weekly, and also an adolescent mental health group, 1 time weekly, was recommended. During these sessions, Josh and Sarah would work together to meet clinical goals such as emotional regulation, which could include anything such as managing his anger, improving effective coping skills, and implementing mindfulness. Throughout treatment, Sarah would also gather a release from Josh's probation officer in order to collaborate with him or her on the case. Sarah would continue to collaborate with both Ashley and the probation officer in order to monitor Josh's updates, such as any progress reports, any changes in the levels of care, and again, consult with one another to ensure optimal care for Josh. Sarah would continue to assess Josh for additional needs throughout the treatment course and provide referrals as needed, such as case management or additional mental health services. And finally, just some things to keep in mind: barriers to treatment, especially right now with COVID-19, but also being in a medically underserved location. There could be a lack of resources, such as specific programs which would be relevant and beneficial to Josh's case. short-staffed agencies. There is a higher turnover rate and extreme burnout right now, longer wait times and wait lists to get into treatment or services, the lack of transportation, and also any financial barriers. Thank you for watching our presentation.